Hello! So I'm Kim, and I am going to do my Help a Learner assignment for Cheryl's class. And the topic I'll be talking about is the high sensitivity troponin blood test, which is a cardiac biomarker test in the diagnosis of acute coronary syndromes. So, acute coronary syndromes are any condition brought on by the sudden reduction of blood or blockage of blood flow to the heart. It's usually caused by a plaque rupture or a clot formation in the heart's arteries. So these are the arteries that actually supply nutrients to the heart. These conditions all cause what's called myocardial necrosis. So they all cause actual, tissue death to the cardiac myocytes. As we know, heart issues in general are extremely common in the U.S. with our high incidence of obesity and diabetes and all that stuff. So I would say that this is definitely something that any person getting into the healthcare field should be interested in. And I should mention that this particular test is utilized a lot, especially in the emergency center. So when people come in complaining of chest pain or shortness of breath, they're typically going to get a troponin blood test because it has kind of become the creme de la creme of cardiac biomarker tests. There's been many before it that have kind of become extinct because this one is so good. So a little background to this topic. In Unit 8, Objective 1, we talked about troponin as part of the skeletal muscle contraction unit. And Cheryl actually mentioned this test as a little clinical application in the notes. And when I read it, it just seemed like slightly outdated. Like I don't think she's updated it to include this high sensitivity test. Because now it's not just a test used to determine if someone's had like a full-on, myocardial infarction or heart attack. They also use it to determine if someone's just had like a mild case of ischemia, so just a mild case of reduced blood flow to the heart. So we have people that come in their 30s and they're getting troponin blood tests, not necessarily because doctor thinks they've had a full-on heart attack, but they are concerned that they've just had a little bit of a blockage or something, which if you do have a little bit of cardiac muscle tissue death, it's good to know that because it's more likely that it will happen again. So that's kind of the clinical significance of that. So I first kind of wanted to explain the specific type of troponin that I'm talking about here. There's the type of troponin that's being analyzed in this cardiac biomarker assay. So we learned that troponin is found in all muscle tissue in the body, but we know troponin as a regulatory protein in muscle contraction, and it's the one that binds with calcium and then induces a conformational change in the tropomyosin, which allows the actin, or I guess the myosin binding sites on actin to be freed up so that the myosin can finally bind to actin. And remember, actin is the thin filament, and so troponin is associated with that actin thin filament. So one thing that I didn't know about troponin until I did this little study here is that it has 3 subunits, and so 2 of those 3 are actually unique for cardiac troponin. So when I talk about troponin levels, it's going to be either a level of a specific subunit, either the troponin I or troponin T subunit. These are the 2 that are unique for cardiac muscle tissue. And my particular lab, we analyzed troponin I. It's kind of arbitrary which one you're any given lab decides to analyze, because they both indicate the same thing. So some of the behavior is a little bit different. Just got to know what you're working with. So for troponin I, this subunit is going to start to elevate in 4 to 6 hours after your initial onset of symptoms. And then it's going to peak after 12 to 18 hours. And then it returns to baseline, which is basically like 0, after around 6 days. And I just wanted to mention, a little side note, I thought this is kind of interesting, but so when you first see troponin levels rise, it's going to be this free troponin in the cytosol of the cardiac myocytes. That is the first troponin that's going to be leaking out into the bloodstream. And then with time, the myofilaments, the troponin in the myofilaments, are going to start ending up in the bloodstream. So those myofilaments start to break down. I just thought that was kind of interesting. But anyways, so the thing that people really do not enjoy about the troponin blood test is that it's typically measured in a 3-part series. So you're going to get it measured right when you come in, and then after 2 to 3 hours, you get another measurement. After another 2 to 3 hours, you get another blood draw, another measurement. So you end up getting poked like 3 times. And this is incredibly important because of, first of all, that delay period that I talked about, the 4 to 6 hours. Even if your first troponin value is 0, it's possible that the troponin just hasn't yet increased. And they've completely missed that increase. So there's that. And then I think the doctor also kind of just wants to see how the troponin is trending, because troponin will actually it increases to the extent of heart damage. So if you just have like a small amount of increase, it's going to mean you had just small incidents of ischemia. If you have a big increase, it'll mean that you had a much more severe heart attack. You've had a lot more tissue death, which I think is really cool. That there's a correspondence there. So before talking about the utility of the troponin test, or the high sensitivity troponin test, I thought I should mention other conditions that can increase troponin without indicating an actual heart attack. So things like sepsis, intense exercise, different types of medication, different types of cardiac inflammatory conditions or infections, heart failure or cardiomyopathy, which is just like a weakened heart, pulmonary embolism, so a blood clot in the lungs, diabetes, or I think like any lab value. If you have kidney disease, it could be elevated because your kidneys aren't working properly. So why is this high sensitivity troponin test so ultra fabulous? Well, you guys, it's great because it's become such a fast biomarker of whether someone had a heart attack or not. It's very sensitive. You get results incredibly fast. It's considered an accelerated test. And so you can more quickly determine if an aggressive anticoagulation therapy is needed for someone, or maybe some sort of invasive interventional surgery like putting a stent in. And it helps to reduce the time that patients spend in the emergency center, and also it's made it so that less cardiac patients have to stay in observation overnight. So it's saved the healthcare system quite a bit of money. And I suppose that is it. One more thing I want to mention is that the troponin test is just one piece of a very complex puzzle that a doctor has to determine what's going on with the patient. So it can't be the one determining factor. There's always going to be a million things that go into a doctor's diagnosis. But yeah, so last thing I want to mention is that I got my information from Mayo Clinic websites, healthline.com, and the University of Washington website, which we actually use at my job to do phlebotomy training. So I hope you learned something from this. Thank you.